Why is gender-affirming care the option medical professionals choose? Hey op, I'm a non-binary trans person, and while many of the responses answer parts of your question, it seems no one has addressed it as a whole. So I'm happy to break it down into parts for you, addressing each part of your question. 1. Altering the body to match the mind. Are there other conditions where we do this? Actually, yes. Body integrity disorder is one such mental disorder, in which the individual believes a body part does not belong to them, or should be amputated. For decades we tried to treat BID with therapy and medication, but found that the individual's distress would only remit once the offending limb was removed. Therapy and pharmaceutical intervention were so ineffective that people with BID would find other non-medical ways to remove or amputate their limbs, often leading to complications, sepsis, and death. If you interview people with BID post-amputation, they overwhelmingly report their quality of life has improved, even though they are now disabled. And here's another kicker. There are often no other signs of mental illness. BID isn't associated with histrionic personality disorder, or some type of Munchausen's. In brain scans of individuals with BID, you can see the center of the brain associated with that part of the body is not functioning properly. Short of developing some type of complex neurosurgery to fix it, this is the best option we have. Quick note here. There is a common myth that trans people have brain scans that align with their preferred gender. This myth was perpetuated in part to normalize the acceptance of trans people back in the 90s. But its continued perpetuation is harmful not only because it is scientifically false, but because it invalidates the gender identities of non-binary trans people. There is actually no such test, nor are there structural differences between a male and female brain, though hormones do have a noticeable impact on biological function and can in some senses change the brain. You wouldn't be able to see this pre-RT. More on this later. Despite some interesting face value similarities between body integrity disorder and gender dysphoria, BID and its treatment is fundamentally different from something like gender dysphoria and gender reassignment surgery, which are only partially related to discordance with the body. This is because there are many types of dysphoria: body dysphoria, relating to the body as a whole, gender presentation; bottom dysphoria, relating to genitals; and social dysphoria, the way people are perceived socially and culturally in terms of their gender, are some of the most common. Though there are other types of dysphoria as well, such as voice dysphoria, height dysphoria, etc. It is also important to note here is that not all trans people even have dysphoria. Many trans people simply have euphoria from presenting or transitioning to the other gender. Additionally, non-binary trans people, who identify not as a man or a woman but as something between those states, may choose to do hormone replacement therapy to alter their body composition or voice, but not their secondary sex characteristics, breasts, genitals, or they may get gender-affirming surgery, such as top surgery to remove the breasts, but opt not do HRT. There is a huge range of types of trans and non-binary trans people, and within that range there are an endless amount of expressions and identities. Some of us have social dysphoria but not body dysphoria. Some of us get surgery and HRT and others don't. Some of us change our names and pronouns but don't change anything else. Some of us do a mix of the above, caring selectively about some things but not others. I know some trans women, for example, who had profound social and body dysphoria but not bottom dysphoria, so they took estrogen and transitioned socially but did not take testosterone blockers, and therefore retain full use of their penis. 2. Why do people get to choose their gender? We don't. That's kind of the point. Actually, we were born into the bodies we were born into. And if we're the lucky 99%, our bodies match the gender we are. If we are the unlucky 1% that is born trans, we have to negotiate with our bodies, hormones, and socially constructed societal roles to change what doesn't feel right in order to lead authentic lives. I don't know your gender, but imagine if you woke up tomorrow in the gender of the opposite sex. How long do you think you'd survive before you lost your mind? Once the novelty wore off, you'd be left horrified, isolated, and dysphoric. Living this way is unsustainable for trans people, and we don't get to choose it. There isn't something wrong with our brain, like there is with other mental disorders, and the only reason it is coded in the DMS as a disorder is so that therapy for gender dysphoria can be coded and billed through insurance. It is a common misconception that being in the DMS somehow validates that trans people are mentally ill. Know what else is in the DMS? Grief. This is so people suffering from the loss of a loved one can get insurance to cover their therapy. 3. Why can't we align the mind with the body rather than the body with the mind? Because there is nothing broken with the mind. We have decades of neuroscience to substantiate this. Gender is, in large part, a social construct, but this does not invalidate the realness of that construct. We have a personal relationship with our bodies, just as we do with our minds. They are not separate entities. If you went blind, or lost your ability to speak, you would feel like you were losing a part of yourself, not just your body, right? A huge part of our identity as humans relates directly to our bodies, how they are perceived, and how we perceive the world through them. It's really no different with trans people. There is a feeling of loss as well as a feeling of burden, and the need to attenuate the loss by adding what is missing: breasts, a penis, longer hair, and subtracting what is burdensome: facial hair, a penis, beasts, is really the only way to make people feel whole. Some trans people require only a select few of these additions and subtractions, and some require all of them. Needing one, some, or all does not make people any more or less trans than someone else, though, because being trans really just means we don't identify with the gender we were assigned at birth. 4. On gender-affirming care for cis people, I am actually a huge supporter of GAC for all people, not just trans people. You're a cis man who can't get hard and need to take Viagra? You should take it. You're a cis woman who feels like less of a woman BC you're flat-chested and want breast implants? Get them. Gender-affirming care and HRT, hormone replacement therapy, is actually routinely practiced for cisgendered people in the medical field. We just haven't politicized that as much yet. For example, menopausal women are routinely prescribed hormone replacement therapy in the form of birth control to level out their hormone levels as they drop or fluctuate due to menopause. Similarly, it is not uncommon for cisgendered men to receive extra testosterone due to low T levels, which can have debilitating health impacts. Gender-affirming care is also crucial for intersex people, who may have phenotypically male or female presenting bodies but are hormonally misaligned. Or you have conditions where a man was born with ovaries, or a woman was born without a uterus, and needs to be on medication to correct hormone imbalances. We don't talk about intersex people much, but they do exist, and in higher numbers than you'd think. Some people even go their whole lives without knowing they're intersex at all, until they try to conceive, or have other medical complications later in life. The reality is that everyone cisgender, transgender, intersex, and those with medical conditions all need access to quality healthcare, including gender-specific medical interventions. Of course, in an ideal world, we should all have access to what we need to feel happy, healthy, and whole. The reason trans-affirming care is prioritized over cisgender-affirming care is because without gender-affirming care, trans people simply kill themselves. I just want to say, I really appreciate you coming here and asking this question with an open mind and an open heart. There is so much misinformation and propaganda out there and so many people who want to hurt and kill us for being different. Trans people don't want special treatment. We want the same things you do to lead a life where we can wake up in the morning and feel comfortable in our bodies, where we can struggle and suffer and triumph and succeed, where we can find love and love ourselves. That's it. That's all it is. And it starts with people like you, asking questions in good faith and being willing to hear the answers. Heyo, you got so many answers already. So I'll try to focus on only a small part. You mentioned in an edit not knowing what gender even is, and why people get to choose. The thought experiment that worked for my dad is as follows. Imagine yourself growing up with a penis, always identifying as a man, and people saying, yes OBV you are a man. You have a penis. Quote. And then you have a tragic accident and your dick is gone. Would you start saying you are a woman now? Would you identify as a woman? Now you might say, no OFC not. My testosterone is high. OFC I'm a man. Yet when you age your testosterone will naturally lower. Are you a woman then? Now you might say, but my chromosomes show I am a man. Quote. Well, do you know so? A lot of people are intersex and don't know. Also, my chromosomes say my hair should be blonde. Yet no one gives me grief if I dye it green. At any point of this thought experiment, would you have stopped saying you are a man and started describing yourself as a woman? Probably not. That's gender. It's an intrinsic thing. People just know. Children develop a sense for gender around 4 years old. That's when they first understand the difference somewhat. In this experiment, without a dick, with low testosterone, imagine if doctors said, I mean we could just make your body female now. Would be easier than trying to fix you back into an average male body. I don't think any cis, non-trans man would take that offer. 'Cause your brain knows that's not who you are. You would be deadly unhappy. If you are interested in exactly how unhappy it can make a cis man being forced to live as a woman, read about the John Money experiment. And this whole thing is the same for us trans people. Just that I can't tell people, I had an accident. I lost my dick. I never had one. But my brain knows I am no woman. It just does. It took me a long time to accept that. And it takes others even longer. There is people transitioning at age 60 because they finally couldn't bear it no longer. Besides that, studies have shown that conversion therapy, trying to alter the mind instead of the body, does not have a high success rate. In fact, it doesn't make people cis. It makes them go back in the closet or end their lives. The same way a gay man can't just make himself love a woman. The same way a straight man can't just love a man. OBV speaking of romantic love here. And studies show that altering the body to match what the mind knows is right has barely any regret rates. Less than any other surgeries. As far as I have seen, it gives people quality of life they wouldn't have had in any other way. Top surgery, a type of gender-affirming care, has a lower regret rate than almost any other surgery in common practice. It's so low that the study couldn't perform some statistical analyses because the data were so uniform. The regret rate of surgeries in general is about 1 in 7, whereas for gender-affirming surgery it's about 1 in 100. https www.them.us/story/top-surgery-satisfaction-la-regret https://pubmed.ncb nlm.nih.gov/2824369/. I don't have much to add as so many people have left incredibly helpful and detailed responses already. But as a trans person, I want to thank you for your kindness and open-mindedness. Seeing how you've responded to people in this thread is such a breath of fresh air compared to a lot of stuff I see on Reddit. It's heartwarming to see. The difference between mental illness and gender identity is that gender identity has a concrete result. Someone who was born female but feeling male will actually be happy once they have a male body. But someone with body dysmorphia will never be happy. There will always be something else to fix. I want to be female, or I want to be male, is the same as saying, I want to have $10,000 in my account. I want to be prettier, or I want to be skinnier, is the same as saying, I want to have more money. $10,000 is a solid defined amount that once reached is accomplished. However, just wanting more will always leave you wanting more. Such as prescribing plastic surgery for body dysmorphia. So I'm trying to understand why plastic surgery is a treatment option for gender dysmorphia. Body dysmorphia and gender dysphoria are two completely separate things. People that suffer from body dysmorphia do not see their bodies as they really are. Objectively attractive people see themselves as ugly. Thin people see themselves as fat. No surgery will change that, and if they have surgery they often won't be satisfied. People who have gender dysphoria aren't delusional about their bodies. They may very well understand they present as a conventionally attractive woman. They just feel that doesn't match their true identity. Undergoing transition is likely to alleviate symptoms of their dysphoria and make them more comfortable in their own bodies. On the same topic, I don't understand gender. Why do people get to choose whatever gender they want to identify as? They don't choose. They are that gender. Their body just happens not to match. Wouldn't it be more healthy to align your mind with your body rather than attempt to align your body with your mind? There's no evidence that's possible. Just like conversation therapy doesn't work for people who are gay or lesbian. Just trying to live as the gender you're assigned doesn't work and isn't healthy for trans individuals. The first thing to note is that we can't align mind with body in that case. Someone's identity, which gender identification is a significant part of, is not a symptom like with what we treat in regards to mental illnesses, but rather a base part of how your brain's consciousness is structured. We don't have even close to the brain chemistry knowledge to be able to change things like those in ways that are predictable and useful. Second, even if we could, we probably wouldn't want to, because changing someone's mind to align with their body would be changing who they are as a person. Treating mental illness symptoms is not the same thing as trying to change someone's mental baseline entirely. Essentially, one's gender identity is a base part of what forms one's identity, not a mental illness or mental imbalance. We both don't have the tools or techniques to effectively change it. Nor would most people want to change their identity on this fundamental of a level even if we did. People don't choose their identity in the way you're probably thinking of. When people say people are free to choose their identity, what they're actually saying is the freedom to express their true identity even when it doesn't align with the traditional categories. Thank you for asking you questions in such a civil and respectful way. On the same topic, I don't understand gender. Why do people get to choose whatever gender they want to identify as? Wouldn't it be more healthy to align your mind with your body rather than attempt to align your body with your mind? People actually align their bodies with their minds frequently in our society. And it's often related to gender even for cis people. When you wear clothing that feels right for you, that's a cosmetic way to align your body with your mind. The same is true for haircuts, hair dye, makeup, removing or not removing facial and body hair. styling facial and head hair, piercings, tattoos, wearing or not wearing jewelry, and any other kind of visual change people choose to make to their bodies. Cis people also get cosmetic surgery voluntarily to make their bodies match their mind's breast. Implants and reductions, liposuction, lip injections, muscle enhancements, facelifts, Botox, etc. Finally, there's also body sculpting that takes place as part of a workout routine: losing weight, gaining weight, bulking muscle, leaning out muscle, even deliberately having no significantly noticeable muscle is all part of making the body match the mind. Making the body match the mind is something that literally every single human being alive does. We get to choose how we look, how we present ourselves to the world, and in many instances there is an underlying gender reason for it, even for cis people. It can be because being a woman or a man who looks X way is a deliberate part of their gender identity and gender expression. This isn't something only trans people do, so it's honestly kind of weird to single trans people out, as though they're the only ones doing it when they're not. Everyone gets to choose their own gender, including cis people, and everyone gets to make their bodies match their minds, including cis people. While you might personally dislike the choices others are making, maybe you're not into tattoos, piercings, makeup, flannel shirts, jewelry, short hair, long hair, etc. It's not about your personal opinion, it's about theirs. Why should trans people have less bodily autonomy than anyone else? Why should personal choices about how we look and present be subject to societal approval? Why should the approval of others have the power to dictate how individuals choose to present themselves? Transgender person and nurse here. For transgender individuals, gender-affirming care is the only viable treatment. The alternative to gender-affirming care is conversion therapy. I can't link to it now 'cause I'm outside, but it has been proven time and again that it does not work, and in fact causes further mental trauma and hurt to the recipient. Conversion therapy is the matching the mind to the body method. So that leaves gender-affirming care. There are many different aspects of gender-affirming care, from counseling to therapy, to puberty blockers and hormones and surgery. There are maybe different treatments, and what works for each person may be different. Yes, hormones and surgery may seem severe, but I've been on hormones for a year now, and for the first time in my life I am happy. I've tried to be happy with my body for 20 plus years, but I wasn't satisfied. Gender-affirming care also leads to better mental state and reduced depression and suicidal tendencies. Yes, it can appear extreme, but it is the only option and the results are worth it. Let me know if you've any more questions. TLDR. Gender-affirming care is given 'cause it's the only option. Not gender-affirming care is conversion therapy, which is harmful because it does the least harm, or, one might say, does the most good. In short, because it's the only one that works. Attempts at conversion therapy can do nothing but fail because you cannot forcibly change a person's gender. In contrast, gender-affirming care is impossibly effective, with a stunningly low regret rate compared to other surgeries, medical treatments. A small but significant point. Gender-affirming care is a broad term that encompasses much more than surgical or pharmaceutical interventions. A medical assistant referring to a patient using their preferred gender pronouns is also gender-affirming care. Just something to watch out for, as anxiety about medical procedures, particularly with regard to minors, is being exploited by politicians in some U.S. states to ban all forms of gender-affirming care. IDK if this adds anything, but I spent almost 15 years of my life trying very hard to be a man like the body I had at the time told me, but I couldn't. So I transitioned, and now even on my saddest day, I am still infinitely happier than my happiest day trying to live like a man. Everything about this feels right. With estrogen, even my mind works better. I can actually be the best version of myself cause I no longer have to pretend to be someone I wasn't. And this has been the experience of almost all trans people. Being trans is about happiness. A second chance at life. It's society that causes much of the sadness and hardship. I'm cis, so I don't have much to add. But I want to point out that cis people have gender-affirming surgeries all the time. I had a breast reduction myself and no one batted an eye about it. Just here to say, a lot of people like you wouldn't bother trying to learn at all. And good on you for doing so. Especially here on Reddit, where you're virtually guaranteed to get plenty of negativity and snap judgments. I doubt we agree on much. And that's okay, but just trying to learn where others are coming from is a big step. And it's a good thing. Like some people said, matching the brain to the body would be conversion therapy. Matching the body to the brain is best what we have right now. Gender dysphoria or transsexualism is basically the mismatch between the brain and body. We don't choose our genders. We have gender dysphoria, which is what we are born with. Gonna get downvoted for this, but respecting pronouns, and cis people get gender-affirming care. Is not gender-affirming care and not helpful, even though I see where people are trying to come from. Saying that is what could get trans healthcare taken away, since it could be seen as unnecessary or cosmetic. Gender dysphoria is a real disorder and not a choice. It's sometimes hard for people to understand, I get, since it is not a physical thing that can be seen. Transsexuals are just trying to cure their disorder and live normally. Look into transmedicalism, which is the belief that trans healthcare should stay medicalized and help cure the gender dysphoria that trans people experience. Wouldn't it be more healthy to align your mind with your body rather than attempt to align your body with your mind? Quote, believe me, if that worked, there would be approximately 0 trans people. That would be the easy option if it was possible. It isn't possible. A person's internal sense of gender isn't something they just get to choose. The options, if it doesn't match your body, are either transition or live in a miserable state of denial and repression until you can't stand it anymore, and either transition later or off yourself. Or if you're lucky enough to have a tolerable dysphoria level, to live your entire life less happy than you could be if you transition. Why try to force yourself to accept being unhappy when you could instead just be happier by making a few changes? Transition isn't that dangerous these days. Sure, no medical intervention is completely risk-free, but HRT is basically the same thing as human bodies make on their own, just for the type that a specific person's body doesn't make enough of for them. Cis men with low T imbalances take the same medication that trans men take to transition. Postmenopausal cis women take the same medication that trans women take to transition, to maintain their hormone balance. And same for cis people who had to have their gonads removed for medical reasons, like cancer, or lost them to injury. Same meds, same purpose. It's not materially different. Top surgery for trans men isn't significantly different from a preventive mastectomy for a cis woman at high risk of breast cancer, or a major reduction for a cis woman whose breasts grew so large they're screwing up her spine. Except that she's probably going to opt for feminine reconstruction or leaving some tissue to maintain a feminine shape, while the guy wants a masculine chest. Bust enhancement for trans women is identical to a boob job for a cis woman. And many trans women find that HRT gives them plenty of boob anyway. Even phalloplasty was originally developed for cis men who lost their penises to injury, and applied for trans men later. I'm a woman with thick black facial hair. Getting is removed through plucking, waxing or laser. Counts as gender-affirming care. Very unpopular opinion, but maybe people should just be allowed to have bodily autonomy and change their body if they so choose. I choose every day to be trans, and I'm choosing to medically transition, and I have no doubt that if I was born into a different body I would still choose to be trans. Lily Alexander has a good video about why trans people. You were born some way that makes you trans. Maybe not. I cannot know, and I choose to focus on the autonomy of it.
If you enjoyed this video, please check out our playlists full of similar content. Epic Aircast is like doom scrolling for your ears. Please like, share, and subscribe.